In the GHA, 1,247 antibody tests were carried out in the last 2 weeks, starting on the 1st of June. 18 were found to be positive for COVID-19 antibodies. That equates to just 1.4% of those tested. What this means is that we have a low level of measurable antibodies in this specific group. Although GHA staff are not representative of the whole population, it does demonstrate the understanding all along that the picture of immunity is complex and comprises of antibodies, cellular immunity, and many other factors. We now need public health advice as to whether testing the whole population will have any value with such a low prevalence of the virus and the antibodies, especially there in the GHA on the front line, where we might have expected to find more. It appears that antibodies arise between 3 to 4 weeks after symptoms and fade 4 to 6 weeks after that. Around half of our swab positives are now antibody negative. Whilst it does not mean immunity fades, it implies that immune response, the type of thing that we test for in the Abbott test, to the core protein does fade and quickly. We were therefore smart with our antibody test orders and ring-fenced the 35,000 tests we needed, but we had them delivered and only paid for in batches. So we didn't have 35,000 tests arrive in one go, as some appeared to be pressing us to do. We have 4,000 or so in stock at the moment that will expire in mid-July. What we're considering doing, based on advice of course, is to age stratify the population with the GIS data and then sample a representative 10% of the population to give us more research data.